the last speaker made comments about the effects on, on states that made it legal and teen drug use. And I frankly disagree with his statements. I have, the statements that he was saying, I have right here, and I'll be happy to show them with you from SAMHSA, a National Household Survey on Drug Abuse. This is the most recent available data of 2009. The devil is in the details often with data. In many of the states where marijuana has been used as medicine, the rate of marijuana use in teens has gone down. But it went down nationally. It went down much more. It went down to twice the rate in states that did not do that. Let's look at in 2006, when there was 10 states, they list the states with the highest rate of teen drug use. I find little comfort in seeing that the top three, Maine, Montana, and Vermont, are states that have medical marijuana. In fact, Maine, in 1999, before it was ranked 28th, it went up to number 1. In fact, when there was only 10, 5 of the first 8 were states that legalized that. I can't predict what's going to happen in Pennsylvania, but for people to say, no, it's not going to have an effect on our youth, or guarantee you that it's going to go down, that's very flawed. And one of my concerns about Pennsylvania and Maine have a lot of similarities in terms of older population or working class population. In terms of the OxyContin and problems like that, they saw similar things. And just a word of concern, yes, we see problems with other medicines like OxyContin and Vicodin, but that's within our current safety system. Could you imagine the problems we'd have if we went outside of that system and went rogue with that? That's why I'm saying it's better to stay within the system. I mean, the big question is, should we cast aside the concept that drug safety and efficiency should be assessed scientifically on the basis of risks versus benefits, and just open it up to popular vote? We don't do that with other medicines. We shouldn't do that with this. So what are my suggestions? My suggestions are that we push for more research for pushing medicines that, and I have no stock or don't work for the companies that make any of these products. Push for approval of a medicine like F.A.S.A.M. Look at some of the guidelines from the American College of Physicians. They have an excellent paper that I think is a very rational approach supporting studying marijuana, as does the Institute of Medicine. And I agree with their conclusions that we need more research. They also say, while we're waiting for that research in side effects, I could even open up the possibility of allowing smoked marijuana for certain people that are properly evaluated to make sure that no other products have been really effective for them, that it's of an urgent nature, and that it be studied for a limited period of time until there are better things. That would account for a very low amount of people, not just open up the door. When I talk to my patients from other states, many of them say it's just become somewhat of a farce. You go to a doctor, you say you're stressed, you have headaches, and there's people in their 20s and 30s who get it because they want to use it for recreational use. But if that's what you want to do, have a different bill, a different discussion. For medical use, let's stay within the ropes. And for stories like Ron Owens and her daughter, I think we owe it to the people, I owe it to the safety of our citizens to do that. And if you need my help, which I volunteer for you, you may not ask for it or want it, but I would be happy to go over in more detail some of these suggestions in these booklets to do it in a responsible way. Thank you for your time.
I certainly will follow up with you because some of the things you said did have me thinking about maybe the bill and ways to address the bill and try to get at some of the concepts that I think the prime sponsor wants to get at. But to my colleague's broader point, I think at some point, as a General Assembly, as policymakers, we do need to look at the overall strategy that we've kind of taken on. And I believe it is a public health discussion more than it is a law enforcement discussion.
Because again, I say for a lot of people, this is a moral question, more so than a criminal question or a medical question. It's a moral question. You got to say, do you want to do it just because you want to get high? I'm going to go back to Philly. Turning me with the chick told me. But when he was talking, for some reason, what kept going across my mental state was the TV and the prescription drugs and the disclaimer at the end. If you take this drug, you might chop your head off. You might go kill your dog. You're going to be stressed for 10 days. You know, but talk to your doctor about this prescription drug, you know.
Well, your doctor can tell you what are the odds of that.
Yeah, but the doctor said, I'm going to cut your head off, which you can 6 to 9 days. But the point I'm making is that the disclaimer, the side effects, and the tertiary situations that arise out of drug abuse, I agree. You caught my attention when you said that there ought to be a protocol. You actually caught my attention, you know, because some of these drugs that people are taking now, when you decide to retest them, they find they're doing more harm than good. You know.
And that's part of the FDA follow-up. There's phase 4. You do ongoing monitoring.
Yeah, they have a prostrate drug that people can take it, and then they say, man, you should never been taking it. You've been taking it for 9 years. You know. So I do support the notion that it needs to be looked into. And when we get back to Harrisburg, you know, we're going to continue to have this dialogue. There are many people in Harrisburg that feel the same way that other homes feel. That if you got to smoke it while you can call it medicine, you know, and therefore it should not be measured or described or discussed in medical vocabulary. You know, if you got to smoke it, you know. Of course, I was thinking about some of those Italian westerns.
Spaghetti westerns.
Yeah, Italian westerns. Yeah, you know where. They be riding down the street smoking something, you don't know what it is, but the music starts playing. But in all seriousness, I'm glad I was able to come to Pittsburgh today. I'm glad that I heard what I heard. And I know we're going to do another one in Harrisburg, man. Hopefully we'll get some more insight. Again, I'm serious about the solutions. But this is not going to go away. You know, it's not going to go away. There's going to be some winners, there's going to be some losers. But I do believe that marijuana is going to get wrapped into the medical profession some kind of way. You know, and I know there's a strong move against it through the pharmaceutical companies. They can't patent it. You know, they can't say, well, you know, this is Merck, Sharp and Dome's joint, you know. You know, so.
If we could do it in a way to keep big pharma out of it, that'd be fine.
Because I said, the profit is corruption, you know. They can't figure out no profit, so they're going to try to corrupt it. They're going to try to keep it off the table and use Megace instead of joint to increase appetite. Again, thanks.
Thank you, Mr. Chairman, for being here.
Good meeting y'all.
I had a question that I wanted to ask you about the case. Thank you, sir. Talk about 9%. Is have you found in your practice that this somehow can be mitigated for folks?
Well, the whole gateway drug scare is one of debate. It's a controversy. It is true. Most people who use marijuana do not go on to do heroin and cocaine and things that are hardcore drugs. But of course, most people who are doing those hardcore drugs started with marijuana. They also maybe started with water too. But we know this. Regular users, heavier users, especially as teenagers, the more you use, the more likely you're to continue to use. And the more a drug becomes available, the more people are going to use. Look at what happened with prescription like opioids like Oxycontin and which is oxycodone and Vicodin. Their prescriptions went up about 500, 600% from 98 to 2005. And what did we see? We saw addiction rates. Nationally went up about 400%. Locally they went up. We've even seen a 400% in drug overdose deaths because that things become more available. Something is more available. It generally trickles down and becomes available to youth. It's an area of debate. I don't know if medical marijuana is approved. that's going to increase, but that's an area of concern. That's what increases things. We need to be careful about that. I do know that unlike milk or water, marijuana does work in the part of the brain, the limbic system, the reward system, and activates, especially for people that may have genetic predispositions to conditions of addiction, that may make them more likely. If people have genetic predispositions to mental illness, may make them more likely to tip the scales for them. Maybe not people who don't have that, but a lot of people up front, they don't know. You're not born with a report card, here's your genetic risk statement.
Thank you.
Thank you.